Hey guys, how are you? Welcome to my YouTube channel. I'm really glad and excited to have you on board. My name is Dr. Victoria, and here in this channel we discuss all matters related to obstetrics and gynecology. Welcome. So guys, today I want us to talk about the uterus. The uterus or the womb. It's a very important organ in the body of any woman. But then there comes a time where a decision is made and this has to be taken out. The removal of the uterus surgically, what we refer to as hysterectomy, is not a decision that's arrived at easily, and it's not a decision that we as women will also accept easily. But this is a decision that is made many times, 99.9%, if not 100%, for the sake of the woman, to save the life of a woman, to save the burden of morbidity, and at times to save the cost and the loss from mortality. What are some of the things that could lead you to having your uterus removed? Before I go to that, in this photo, as you can see, that's me there, holding a uterus or a womb, how it looks like. A surgical operation that has been done. Now, what are some of the reasons that could make a doctor or a health worker decide that now I think it's best we do away with this uterus? There are many reasons, but the most and the number one most common reason is in cases of fibroids. At times you get women with multiple extensive fibroids. You can literally feel it on your abdomen, and this also causing complications, making you bleed a lot, causing you a lot of pain and other things. So that is one of the common reasons why we do a hysterectomy. The second reason is in cases of abnormal uterine bleeding. You tend to have issues with vaginal bleeding, not necessarily related to your menses. At times, intermenstrual bleeding or excessive menstrual bleeding that makes you bedridden to the extent of having a blood transfusion done on you. The third thing is in cases such as endometriosis, which I already discussed in this channel. You can just find the videos and you'll find the video on endometriosis. The fourth thing that could lead to you getting your uterus removed is in case of a cancer or a malignancy that is affecting it. And fortunately, this malignancy has still not spread to other parts of the body. So if it's just confined to the uterus, then we can have it removed to prevent its spread. The other reason is in cases of what we refer to as organ prolapse. There are times you can find your uterus prolapsing and coming out through the vagina. So we call it organ prolapse. It happens in women. This is something that you don't want to live with for the rest of your life. And at times the best thing is just to get rid of that which is causing the issue. And in some cases where you have infections, chronic infections, causing you a lot of pain, you've taken antibiotics with no recovery, then a hysterectomy could also be prescribed, though that is in very, very rare cases. Now, when you decide and accept to do a hysterectomy, it's done in theater. It's not a very long surgery. I think at most 3 hours, or could be more, depending on what arises in theater, and at times depending also on the skill and the experience of the surgeon, could be something that could take less than 2 hours. So in theater, you can be done for what you call spinal anesthesia. So you're still able to communicate with the surgeon, but now you cannot feel pain, you cannot move your limbs, your muscles are relaxed. or you can decide to go the general anesthesia way, where you're made to sleep and the surgery is done. On which is the best anesthesia to use depends on your surgeon, you, and your anesthetist. Basically, the whole surgical team. Okay? So once the uterus has been removed, we let you stay in hospital for just a few days, 1 day, 2 days, or 3 days, and we can let you go home. After that, you'll be coming for checkup for us to make sure that everything is going on well and you're not suffering from complications of the same. Some of the complications that could arise because of this kind of surgery is you could have postoperative infections, you could have postoperative excessive bleeding, you could have injury to organs intraoperatively, and in other cases you could have clots forming and being thrown either to your lungs, or you have what you call deep venous thrombosis affecting the blood vessels of your legs. Not everyone experiences this issue of clots. It's most commonly for people who are already at an increased risk of forming those clots. So if you are a woman and such a decision is made, many times it's to save your life. And sometimes when you're doing cases, sometimes during delivery or even during a cesarean section, you can find women developing excessive bleeding that cannot be controlled, and you will find out that the only way to control that is to remove the uterus. So that is it about hysterectomy. If you have any questions, feel free to ask in the comment section. And if you'd love to share your testimony or to share your story living after hysterectomy, you're very welcome to do so on this YouTube channel. That's it from me, guys. I love you and I wish you a very beautiful month ahead. Thank you.